Partnerships with public and private child serving agencies are crucial to the way Chapin Hall works and to it ultimately having the impact that we want our research to have on improving the lives of children, families, and their communities. It's the ongoing relationship that I think makes our partnerships unique. We, in some cases, for more than 20 years, have worked with the same public agency. Through many years of working together, through administration changes, new technologies becoming available to work with families, we begin to understand much better and help the agencies themselves understand where there might be traction on an issue and where some improvement might come.
An organization like APHSA is dedicated to bringing states together, and our partnership with them introduces the idea that their work with states ought to include research, knowledge development, knowledge dissemination, sharing of common practices, common solutions with regard to the issues they confront. So our partnership with them is really about maximizing the utility of what's done in one state and spreading it to other states in a relatively efficient way.
The Duke Endowment has a long, rich history in providing services to the families in North and South Carolina. They have a long history of supporting services that primarily do group-based services for children who have been initially orphaned and then more recently that are experiencing foster care placement because of abuse and neglect. About 7 or 8 years ago, the endowment became increasingly interested in prevention. They were wondering, why are we waiting to help these children before they show up in group homes? After years of experiencing abuse and neglect, what can we do further up the food chain, if you will? I began working with them, and we identified 2 programs, one in North Carolina and one in South Carolina, that decided to implement what they were calling community child abuse prevention. That program has been going on now for the last 6 years in both sites, and Chapin Hall serves as the cross-site evaluator for that program. This isn't a project where we'll collect data for 2 years, make a report, and then the funder will pull out and never be in that community again. We really have an opportunity to build something here.
We started working with the Illinois Department of Children and Family Services in the late 70s. A couple years ago, DCFS asked us to look at their residential care program. They had some internal information that suggested to them that there might be some problems with how kids are using residential care, how kids were being placed in residential care, and the outcomes of residential care. One thing we found was that children were only entering residential care after being in 8, 9, 10 individual foster care placements. What DCFS did in response to our research was they put in a whole new assessment system to try to assess children's needs earlier, what their characteristics were after 2 or 3 placements. This helped them get services earlier, helped them get into the right type of living arrangement earlier, and generally improved their outcomes.
Our work with the Tennessee Department of Children's Services is essentially about helping them be more prudent with the use of knowledge. They deal with 85 providers who work with the state to provide all manner of foster care, in-home services, out-of-home services. We've been able over the years to establish that indeed when we look systematically at what happens when kids are cared for by various agencies, that there are differences in the likelihood that a child will be reunified, the child will be adopted, the likelihood that a child will come back to care. And in this particular instance, we looked at the issue of performance-based contracting to see whether or not we can align incentives in the system so that the state is working with providers in a way that has everybody working in the same direction, and the incentives within the system support that collaboration.
The Children's Services Council of Palm Beach County is a special taxing district set up by the Florida legislature to develop services for children and families in their county. So the longitudinal study is to try to understand how the system of services is working for families. And we started with a sample of about 500 families 4 years ago, starting with families who had recently given birth to a child, and we'll be following these children as they enter kindergarten. In order for families to get the benefit of services, they have to use them. And because these are prevention, early intervention services, these are voluntary programs, and families make choices about whether they're going to participate. And so we're learning through this study some of the facilitators, but also the barriers to families participating in these programs.
Chapin Hall is a research institution, and we cannot change any particular policy or practice. My work with courts in disseminating Chapin Hall's research is primarily through presentations and also convening of meetings with various court personnel to discuss our findings and to introduce some of the work that we've done to help stimulate their thinking. And they're able to look at the research, understand the research, and think about larger policy issues, larger practice issues that affect more than that individual case. The synergy that occurs when people are thinking together and reacting to information that they all have allows our research to get stronger and allows their work to be better grounded and more informed.